you can see from the screen that Dr. Karen Cassidy is with UnitedHealthcare. She's also an internist and a pediatrician. Did that in your previous life.
Correct.
You still
Correct.
are a doctor, but you're
Right.
in an administrative position. So tell us about these healthcare rankings, America's Health Rankings, and this is a senior report specifically.
Correct. So recently the specific report for seniors came out, but just to give you a little background on American Health Rankings, this is the longest running, kind of really snapshot. We see both of the country kind of as a holistic overview, but the individual states are ranked as well, which I think is really helpful. And this is put out by the UnitedHealthcare Foundation and the American Public Health Association, as well as a partnership with Partners for Prevention. And so it's a very nice, actionable report that comes out that really lets a state specifically look at where there's areas of opportunity for improving the health of their citizens.
So how did we do? Where are we doing well, and where are we maybe falling a little behind?
Right. So, Tennessee was 43rd for seniors in general out of 50 states, which obviously is not where we want to be. We don't want to be in that bottom third. The good news is that we did improve. We were 44th last year. So moving up 1 point, so we need to be pleased with that, but obviously something we need to continue to have focus on and build on. When we look, there's 35 specific measures they look at, and they're looking at kind of risk factors for disease, chronic disease and illness, so things like obesity, inactivity, diabetes, but also looking at things like availability of physicians in the area or how many people die in a hospital-based setting, and then also kind of social contributors to health and well-being, things like what are your stress levels, is there enough food in the house, things like that. So it's a very comprehensive snapshot and overview.
You had mentioned prior to us beginning the segment today, food insecurity that a lot of our seniors have. What does that mean, really?
So there's pluses and minuses for our seniors in Tennessee. The pluses where we have a really low rate. We're actually #1 in the country for not having excessive alcohol consumption. So a really good thing. We were #6 for vaccinations for seniors. Great. A lot of times we think of vaccines as something that kids do, but there's some real specific vaccines.
Pneumonia, shingles,
exactly,
Okay.
important vaccines for seniors beginning. But we did see, and this is kind of odd, one of the positives that was listed is that our obesity rates went from 34th in the country. We're now 5th. So good that less obese seniors, but the caveat to that, or I guess the hard part of that, was we ranked really high for food insecurity.
Not getting enough food, not getting enough to
eat. Well, and not knowing where your next meal's coming from. So we're 46 for food insecurity, and we were 48th in the country for availability of home-delivered meals for seniors in need.
That's really changed over the years, hasn't it? It seems like people used to, there were Meals on Wheels or different programs, and you said there are programs, maybe seniors don't know about them?
There surely are programs, and actually TennCare is a very robust long-term care program that has home delivered meals as part of what they provide. But I think it's really telling that that's an issue. Also our seniors ranked very high. They were 49th for being under a high level of stress or having poor mental health days. Very high rate of smoking. So I think when I see that and I think about that, boy, looking into your neighborhood, looking at your church population, or people around the corner or near you, trying to make sure that you're reaching out and offering support. I think even just that little bit of contact probably would make a difference to the seniors in our community.
Oh, for sure. A lot of people don't know their neighbors anymore, and if you do have elderly people in your neighborhood, a lot of them might be alone and not have anybody checking on them. That's an important thing to mention. So as you look to the future, let's say the population of 2030, what kind of information have you gleaned from this report to help the future?
And 2030 was actually that baby boomer year that they've looked at, so that those people aging into that over 65 category, and they looked at those people coming up in that 14-year span to say, boy, what will our senior population look like in 2030? And boy, it's remarkably different. 50% less smokers in that senior population coming in 2030 versus now, but a much higher rate of diabetes. 53% of them have diabetes, 53% more, have diabetes, and a 25% increase in obesity in that population. So we're really looking at a very different dynamic at the group that's coming in or aging into that senior population versus what we have now. A lot of similar problems that we see just across the state of Tennessee with obesity and diabetes.
And so what do you do to try to make an impact on that?
Yeah, I mean, diet and exercise is just such an important thing for health in general, you know, whether we're talking about diabetes or cancer risk. So really getting out, exercising, thinking about healthy diet. You know, healthiertennessee.org is a wonderful, .com is a wonderful website that's put out that has some really great kind of actionable tips or ways to get started, both for an individual or a family or even a small workplace or congregation. There's information on how to kind of promote healthier lifestyle.
I want to go back to one thing you said earlier in this final minute or so, that we have mental health and what that issue for seniors. What is underlying, what's the underlying reason for that? Do you really understand what?
You know, this report tells us that score is low. It really doesn't look at those causal factors, but I do think it's something the state needs to back up and look at. But when you think about someone, and like you were saying, we don't know our neighbors and we're not maybe reaching out the way that we should. I think making sure people have connections and contacts. And also when you think about things like food insecurity, I'm not surprised you have poor mental health days if you're not sure where your next meal is going to come from. So I think those global supports and sense of community and wrapping that around our elderly population is just really important.
I think so too. Again, connections.
Absolutely.
And for people to get more information on this topic, whoever's watching, someone that might want a little more information on this, where can you direct them to go? You mentioned a website. Is there any other organization to call?
AmericansHealthRankings.org actually has this report on the website. But there are ways, I think, through different churches in the area that you could reach out. There are specific community resources for the elderly. You could reach out and potentially volunteer or become a part of that. So I think there's other ways to reach out and get involved in your area and supporting our elderly population.
Okay. Like you said, whether it's your neighborhood, your churches, wherever you may be interacting with these folks. Thank you. Dr. Karen Cassidy, appreciate it.
You're welcome. Thanks for having me.
We'll be right back.